my philosophy is curing cancer one patient at a time. So really kind of a patient-centered approach to the diagnosis and treatment and hopeful cure of cancer individually in each patient. Well, usually as I sit down and I'm talking to patients and we're developing a rapport, I make sure that they understand that they're the boss. They're kind of in the driver's seat. They kind of direct their care. Obviously, we use kind of our clinical knowledge and our experience and that sort of thing to present them with different options, but ultimately the patient is the one that decides what they want to do and what they don't want to do. So that's kind of their role, to really sit down and allow us to help them make the right decisions, but their care is tailored usually by them. As I was finishing high school, and I come from I guess a healthcare family. My mother's a nurse. I have a brother that's a hospital administrator. I have two sisters that are nurses. So we have a lot of medical professionals in our family. And really coming out of high school and thinking about what I wanted to do with my life moving forward and what impact I wanted to have on people and society, at that point I kind of decided that I wanted to be a physician. In order to become an oncologist, it's a subspecialty of internal medicine. So while you're doing your internal medicine residency, you kind of have an opportunity to rotate through all of the specialties, whether it be cardiology or infectious diseases or rheumatology. And my mentor happened to be a medical oncologist at the program that I trained at. And I initially didn't know that I was going to have an interest in cancer medicine. But as I spent more time with him and saw what he did and saw the impact that he had on patients and family lives, that I kind of gravitated more towards the field. And the more I learned about it, the more I liked. And then I also saw the disparity in the fact that the incidence of cancer was increasing, but we didn't have enough medical oncologists to treat patients. And so that further intrigued me. Coming here is different for me because I've never lived in a city that had less than 6 million people. And one of the things that we've been surprisingly happy with is the whole small town feel and the fact that everyone knows everyone and everyone is willing to help and that sort of thing. So I think that that's been one of the better things that we've experienced since we've been here. One of my biggest hobbies is working out and going to the gym. And so we go to the CrossFit gym and I see a number of the staff members here from the hospital. And then when we go to the Portage gym, I see patients there on a regular basis throughout the day, and we talk about them and their family and their medical conditions and the whole nine. So a lot of the patients already know that usually early in the morning I'm over at the gym running or working out and that sort of thing. So that's one of my biggest hobbies, and I enjoy seeing them there when I do. I guess we're shoveling our driveway every morning, and I've never had to do that before. And I guess it's enjoyable some days more than others, but we've had deer in our backyard, and we've had all sorts of wildlife and different things, and the snow and the good air and the whole nine. Just taking advantage of the seasons that we have here.